that 1 in 4 people deal with a mental illness, the likelihood of you or somebody that you know experiencing a crisis is very real. One of the most effective ways to deal with an emotional or a behavioral crisis is through the act of crisis planning. This is something that we conduct with all of our patients when they come to Northwest Texas Behavioral Health, but it's also something that you can do with a therapist or counselor, a doctor, psychiatrist, or just somebody that you consider a safe and supportive person. Crisis planning, you might hear it by a lot of different names, such as suicide planning or safety planning, but regardless of what you call it, it has a few key components that I wanted to talk to you about. The first is your personal warning signs. These are going to be the things that you notice in yourself or other people might notice in you, such as isolating more, maybe increased agitation or irritation, depression, anxiety, or thoughts of wanting to hurt yourself. That leads on to the second component, which is going to be your self-regulation skills or your coping skills. These are the things that you can do on your own to kind of help you deal with the emotions and the stress that are coming up. Some of those skills might look like meditation or breathing, it might be physical activity, or it might be more of a distracting skill such as reading, listening to music, or watching TV. Your personal supports is another important part of crisis planning. These are the friends and the family and the safe places that you reach out to when you just need a little bit extra assistance. So it might be friends or family, it might be a pet that you like spending time with, or it might just be a safe place, such as going for a walk in the park or going to a safe place in your room where you feel comfortable. If personal supports are still not helping you or if they're not available at that time, there are always professional supports that you can reach out to. That might look like calling a suicide hotline or a crisis line. You can also call Northwest Texas Behavioral Health and talk to somebody on the phone with us. Or if something gets really scary or really serious, you can always contact law enforcement. An important thing about the professional supports and the personal supports that I want to mention is that those are the people that can help you keep your environment safe if that's something that's needed, such as securing firearms or medications. Another important part of your crisis planning is to identify your reasons for living. One of the things that we talk about a lot in therapy is you always want to have 5 things that you can list off on your hand. They might be people, or places, or experiences, or future goals that you have for yourself that really help you stay motivated and happy and healthy.